don't you need to have be in a long-term relationship though in order for that doctor to be there for you in times of crisis, in in under the circumstances that really build that feeling of trust and that strong relationship.
That's what I think. And I think that is the strongest pathway. I'm fortunate to have had the same family doctor now for a long time. And I like to think that if the chips are down, that if I'm really sick and have some tough decisions to make, maybe even end of life decisions, being with someone who's seen me through thick and thin and over time would be the best thing. So I think there's a lot of advantages to that. But just because that's not available to most people, or most people, or many people don't have that, that doesn't mean that we shouldn't be investing in relationship. And I made this the point that you just made to a colleague of mine, Ron Epstein, a family physician in Rochester, and he challenged me on it. And I thought, he's a family physician. He would totally believe this. And what he's doing now, he's doing a lot of palliative care. And he said, so I get consulted in the hospital when the chips are down, when people are maybe at the end of the line, they're in their fifth or sixth round of chemotherapy and nothing's working. And we get called in sometimes to see if we can help people with not extending their life, but improving the quality of their life. And he said, one advantage I have in that situation is I can really take time with people. So you take time over time, you develop trust and relationship over time. I think that's often the strongest pathway. But he said, I'll take time, and I have time, and I'll come in and I'll talk to people, I'll convene the family, I'll talk about what really matters to people. And sometimes it's hard to have those conversations when you're just living your life and you're busy and you just want to get on with your life. When the chips are down like that, people are more open. They're kind of unstuck. They're open to those kind of conversations. So he said, those conversations I used to have because I knew people over time. He said, sometimes I'm having almost as a stranger coming in, but trying to really listen and try to be there with people during these key moments. I think the ideal is if you have both. I mean, I would love to have my doctor who's known me over time also have time with me during those key moments. And maybe that's one thing that we should try to build into the system. We can have both of those. I think we'll really have a relationship context for care that would really be beneficial for the system and for individuals as well.